in your experience from a transformation point of view, you are involved in the next summit we are running in April month. The theme is transformation, and the sector has seen a lot of change in the last 5 and 7 years, and there's a lot more to come with NDIS review and Disability Royal Commission coming, in the front. What do you think was the next, is what has happened in the past in terms of changes, the way we work and the way we operate and we deliver services? And the second part is, what do you project from here in terms of the next round of transformation we would face?
Well, I think from a broadest perspective, the NDIS is a great conceptual framework. Unfortunately, I don't think it's met its needs the way it was intended. What it's done for certain parts of our community is created markets where markets weren't needed. And it's very much put a focus on hours of service delivery, hour of payment, or particularly in the industry that I work in, which really goes counter to what you try and do. You're actually trying to have a look, particularly with children, about how do you invest that time and invest that resource so when they're older, you don't need so much support. And I don't think it's actually achieved its goal in doing that. But for us, we've moved, like so many others, from a block funding perspective when it comes to supporting children through to that sort of hour of service delivery. And when you do that also in classes or groups, it's different than when you're doing it one-on-one, and there's a lot of focus on that one-on-one space. And there's a lot of work that we do, particularly with children with hearing loss. 95% of kids who have a hearing loss have parents who can hear perfectly. So this is new to them. So that connection, social cohesion with other parents and learning from other families is really important. You do that in groups. And so we've got to challenge that a little bit. The transformation, though, internally has been a really interesting one for us. One where we have to be cognizant of how we actually earn an income from this to keep the doors open, but also make sure our staff are focused on the right things. And we don't talk about money with our therapy staff. We talk about how many services we're providing to those families. And how do you make sure that that culture, which has been such a strong part of our organisation for decades, continues into the future, despite the funding arrangements being totally different than what they used to be. And indeed for us, because we do education and health and disability, it's how do we work across all three of those parts of what every family connects with, and particularly the education system. So we actually provide therapy supports into the education system for children with hearing loss, and indeed for those early years with speech and language issues. So then it's interfacing those things, which is a difficult beast because we don't get the education system connecting with the disability system.